Bright Duty. Every student matters.
Question number 1. What is a healthy state of body and how is it different from being disease free? So, being healthy means being in a good physical, social as well as the mental state of body. Okay, being disease free means there is no kind of disease, either infectious or non-infectious. But being healthy, being disease free is only one aspect of being healthy. Okay, so in being healthy, the person should be physical well-being. Then secondly, he should live in a social equality, socially conducive environment. And third, there should not be any mental distress like tension or depression. So this is how being healthy and being disease free are different, because being a disease refers to only infectious and non-infectious diseases, any kind of improper functioning of organ. But being healthy also takes into account some mental status or the social status of the person. For example, I'll just give you an example which will help you understand. An old lady, okay, she does not have any disease, okay, but she's disease free. But if she's bedridden, she's not able to go out to perform her day-to-day activities, we'll say that she is unhealthy. Similarly, if a person does not have any disease but he's suffering from depression or some kind of tension or stress, then we'll consider it as being unhealthy. Second question, state any 2 conditions essential for good health. Okay, so first can be physical well-being. Okay, like physically you are active, there is no kind of infection. Second, mental well-being, that is there is no depression or tension or any kind of stress. Third is social well-being, that you are living in a society in which everybody treats each other equally. So these are the conditions for good health. Next, state any 2 conditions essential for being free of disease. So for a disease, there should be absence of any kind of infection, there should be absence of any kind of allergy, there should be absence of any kind of hereditary disorder. So diseases are of different types. So if conditions are not there, then we say that the person is free of diseases. Next question, list any 3 reasons why would you see a doctor. We go and see a doctor if only we are not at ease, if we are feeling uncomfortable. If any of our tissue or organ is not functioning properly, then there are certain manifestations or symptoms which we notice. Then only we go to a doctor. So symptoms like cough and fever, then there could be some symptoms which are related to mind, like stress or sleeplessness. Then physically there could be some injury or wound. Under certain these conditions, we would go and see a doctor. Next question, what are the factors that determine the health of an individual? First is public cleanliness. Okay, so suppose that actually is decided by the society in which you are living, whether the garbage has been disposed of properly, there should not be any open garbage in your area, the drains are cleaned and they are covered. So these all come under public cleanliness. The second is balanced diet, whether you are taking a balanced diet or not, healthy nutritious food, because it is important to maintain the immunity of your body. Third is whether the person is disease free or not from any kind of infectious or non-infectious diseases. So health of the individual is decided by the disease or he's having or not, or the kind of food he's taking and the kind of environment in which he is living. Next question, differentiate between acute and chronic disease. There are 2 types of diseases, acute diseases and chronic diseases. This is how we can differentiate. They are of shorter duration while chronic diseases are for a longer duration of time. The patient recovers completely after the cure, but in chronic, the patient does not recover completely because some or the organ is affected, and for example in case of tuberculosis, even after the cure the patient feels lethargic, fatigue, he feels tired all the time and there is loss of weight. So the acute diseases do not cause long-term effect of our body and they have minor effects. But on the other hand, chronic diseases cause long-term effects on the body. Examples can be common cold, diarrhea, and chronic diseases examples could be AIDS, diabetes, tuberculosis. Next question, what are symptoms and signs of the diseases? So, whenever there is some problem in the body, some tissue or organ is not functioning properly, then there are certain symptoms which we notice. Okay, these symptoms include fever, cough, headache. But in symptoms, one symptom can be for more than one disease. For example, if a person has a cough, it could be due to some allergy in the throat, it could be some respiratory disease, could be pneumonia, right? But on the other hand, the signs of the disease, signs are for certain specific disease. They are, we notice the symptoms and we go to the doctor. Doctor looks for the signs. One sign is for a particular disease. For example, if you have fever, you go to a doctor. That fever is a symptom. The doctor will carry out certain blood tests. He will check your pulse and heart rate. He will check your fever. He might check your abdominal cavity by pressing it. So he is looking for the sign to actually decide what kind of a disease you have. Okay, so signs could be increased blood sugar level, some infection, some kind of patch in your lungs. So these are the signs. Next question. In which of the following case do you think the long-term effect on your health are more likely to be unpleasant? If you get jaundice or lice or acne. Obviously, the answer would be if you get jaundice, because lice and acne, first of all, acne is a very acute kind of a disease which can be treated effectively and it does not affect the whole body. It does not affect the major organs of the body. Lice can also, it is a parasite living on your body which can be removed by some measures. But in case of jaundice, it affects the liver. It is an infectious disease. So, disease. It has to be cured by killing of those germs. The body has to fight those pathogens, and then it takes a long time to recover from this disease. So, in this case, the answer is jaundice. Next question. Name few causative organisms and diseases caused by them. The causative organisms we can divide into 5 major categories: the bacteria, virus, fungus, protozoa and worms, and these are examples of few diseases caused by them. Bacteria causes typhoid, cholera, tetanus, tuberculosis, anthrax, etc. Virus causes common cold, influenza, dengue, AIDS, polio, etc. Fungus causes skin diseases like ringworms, athlete foot. Protozoan diseases can be malaria or amoebic dysentery. Worms causes elephantiasis by filarial worm, tiniasis due to tapeworm, and ascariasis due to roundworm. These worms live in the intestines of the humans and other animals and cause diseases. Next question. What are the 3 levels of causes of disease? We can divide the causes of disease into 3 categories. First is the causative organism. So, if there, as I just discussed in the previous question, bacteria or virus or protozoa, any kind of a causative organism, if it enters the body of a healthy person, it grows, it multiplies and affects the tissues and the organs and leads to diseases. The second reason could be the poor health condition. So, if a person does, the immunity is not strong enough, then even a small distress can lead to a disease. Thirdly, unhealthy surrounding. Even if there is no causative organism, a person is eating a healthy food, but he'll be more prone to diseases if he is living in unhealthy surrounding. If there are open drains in your locality or garbage is being piled up. So, in such unhealthy condition, even healthy person are more prone to diseases. Next question, differentiate between the infectious and non-infectious diseases. Infectious diseases, they are caused by some pathogens. So, those diseases which are caused by the pathogens like virus or bacteria, they are called infectious diseases. On the other hand, non-infectious diseases are not caused due to pathogen. Infectious diseases are communicable, that is, they can spread from an unhealthy person to a healthy person, but non-infectious diseases are not communicable, they cannot spread from one person to another. The community hygiene can reduce the incidence of infectious diseases, because if you are living in clean surroundings, then you are less prone to such diseases. But the community hygiene is ineffective in preventing the non-infectious diseases. So in infectious diseases, actually the reason is the factors are external, like pathogens or unhealthy surroundings. But in case of non-infectious diseases, the reasons are internal. Our own body design is the reason. For example, malaria, tuberculosis, measles, they all are infectious diseases. On the other hand, diabetes, goiter, even this cancer, these are all non-infectious diseases.